Hello, friends. Happy Thursday. I hope you are all doing well and staying warm. If you're in the part of the country that the temperatures are dipping below freezing, couldn't get those words out. Everyone being safe on those roads. If you've got snow, when you get here, say hello. Let me know that you are here. You have made it to Medical Billers Network Live, and I'm so happy that you are here. And I want to know you're out there. So pop something in the comments and let me know that you have showed up for you today. And let me know in the comments the question of the day. The answer to the question of the day is, what is your top denial? And if you don't have a denial because you're just learning medical billing, you can just say hello and tell me where you're dialing in from. So, I like this. Michelle, one of our members is in the house. Hi, Michelle. Great hanging out. We've got a Facebook user saying hello. I'm sorry I don't have your name in my front of my screen, but I'm excited that you're here. And we've got Michelle. Oh, hey, Michelle says she just signed up for the medical billing bundle. That's so exciting. So I'm so excited to hear that you have joined us for the medical billing bundle. That includes 2 courses. So you let me know how that works out for you and if you have any other questions. Hello, other Facebook user. Happy that you're here. All right. So Michelle asked a really good question. What is CPPM? So CPPM is the Certified Professional Practice Manager. I should know it because it's my credential, but it's actually one of the credentials from the AAPC. It's a Certified Private Practice Manager, basically, is someone who's working in a medical practice or operating a medical a larger practice group that is has the specialties and expertise of running a medical practice. So we'll say zooming out of medical billing specifically and thinking more practice management, what takes place in the medical practice, all the other bells and the nuts and bolts of running the medical practice, everything but providing the patient care. Basically, it's everything but providing, including staffing and equipment and all of the other fun stuff that it takes to run a medical practice. So I hope that helps. And you can check that out on the APC's website if you want to take a little closer peek into it. So, hey, Christy, what's up, chica? All right, so Medicare Blue Cross Blue Shield with HSR prefix. Really? Darn. I'm sorry about that. That's a rough one. Specifically with one prefix, though. The good thing is you know, and that makes it a little bit more powerful for you to actually hopefully prevent some of those denials down the road. So hello from Florida. Oh, wait, Florida, I'm a little jealous of you right now. We've got like freezing temperatures this weekend, Florida. So stay warm and bring some of that sunshine up here, would you? Hey, from Chicago. Michelle, I didn't know you were in Chicago. So definitely a little cooler there in Chicago, yes? So, Angelica says no sound. Okay. You're watching on LinkedIn. So maybe someone could put in the chat so that Michelle knows when you have no sound on LinkedIn, it's probably because it's doing like an automatic mute. So you just have to tap on the screen and unmute. That's my hunch. Anyway, so if someone wants to tap that in the chat, type that in the chat so that Angelica, my keyboard is down there somewhere. So type that in the chat and then I can put it on the screen for her. So that'd be great. Osama, hey, untimely filing. Ooh, we've got to fix that. That's not a good one. We'll talk a little bit about it today, but that's definitely one that hopefully workflow can support. So some improvements in revenue cycle workflow on the front end can help prevent timely filing denials. So Belinda, hello, great to see you. Michelle says, okay, I can't even remember what I said. Okay, I'm glad you got the answer. April, hello, April, great to see you. Belinda, you're in South Carolina. I love that. So Tyra, what's up? It's great to see you. Let's see, the denial code from the highest level of specificity. Okay, so coding to the highest level of specificity means that we're likely talking about denial for diagnosis codes. And so we definitely want to make sure that we've updated all of our code sets, both the CPT, both the procedure codes and the diagnosis codes or ICDs, so that when we have the new codes that come into play, we aren't using old ones that aren't supposed to be billed on our claim as primary or no longer valid because they're just not specific enough. So that's something that maybe just as a general practice can help. So I like it. Let's see, cooler, not freezing. Oh, that's good. Oh, I'm happy to hear that because I don't know. You guys get some crazy wind up there in Chicago. So, okay, this is for Angelica, if you're still in the house. So that's for you. Hopefully you see that. Sometimes they have mute on the screen, and thank you so much for typing that. I'm assuming Nicole did that since it has my name. So I like it. Oh, okay, cool. Working now. Yay. Awesome. All right. I'm catching up on the chat. So let's see. Top denial from Facebook user, injections, office visits, same day orthopedic specialty, a coder. Yeah, it's 50-50 on payment. Interesting. Okay. Yeah. So that may have to do with, not knowing anything about your practice specifically. But if you have a provider that is doing some in-service, some in-office or even surgical visits, and you have some office visits that you're billing as well, you might have a situation where you've got some like post-op going on, so they're in a global period. That's my hunch, but 50-50 on payment. So you're a coder and a biller, so you probably know more about the code options than I do there. So hey, Todd, let's see. So good to see you. No authorizations, no auth obtained. Ooh, yeah, okay. So it's on the claim, verifiable on the website. Yeah, okay. So in behavioral health, yeah, we know a lot of behavioral health needs authorization, and I know sometimes it's hard to take control over the authorization functions for those clinics. So something that definitely on the front end, a little similar to what we talked about with Sama's question about the the non-timely filing or untimely filing is trying to remedy or establish a process. If one doesn't exist, we're fixing. If one doesn't exist, we're adding one. If one does exist and it's a little broken, we're hopefully making recommendations for them to start with a process. So I love it. Yay. Okay, cool. So specific medication injections, denying. So similar to Shanta's. Yeah. Okay. Did I miss Shanta's question? Okay. Let's see. So Tyra, you're welcome. You're welcome. All right. So many great comments. Yeah, I love it. All right. The comments are rolling and you guys keep adding the comments. I'll keep checking them out. I have housekeeping. So give me 1 second while I just quickly do our little presentation here. So this week, right now, we are going to be talking about effective denial management. And okay, that's not. I just realized that that's not updated. I was like, wait, that's not the right word. That's okay, Nicole. That is literally the first time out of how many times that we've done this. So totally fine. I looked at it before and I think my mind read denials because I knew what we were talking about. So if you are or if you've missed, or this is the first time you've been on YouTube this week, you may not have seen that we had a chat with a practice manager, Felicia Belfast, that went up on Tuesday. And so you can check that out. You can learn a lot about her perspective from starting out very entry level and now being in a leadership position, and how, effectively she does that, and really trying to understand a little bit more about how she leads and the style of leadership, which I thought was a really great conversation. We already established that she is visiting us again to provide a lot more insight and education for our folks that are in the practice management area. I think that anybody who's in the rev cycle can benefit from those types of discussions anyway, because you guys have a deeper understanding of what the practice manager cares about. You can be a better and more effective biller or billing company, because the people that really make the decisions about whether you keep your job is the practice manager, even if the provider owner is the one who actually hires and fires. Who advises them is the practice manager. All right. So before that, last time we talked about effective not denial. Now I'm mixing the words, deductible management and deductibles. We have a whole lot of content that's going to be coming out around deductibles, video and shorts and things. So if that's something that you're still kind of scratching your head about, a lot of reinforcement coming down the pike and some example EOBs and other things that we'll look at together on the channel. So stay tuned for that. All right, if you're new here and you are like, whoa, this girl is talking fast, I have no idea what she's talking about, you have made it to Inlera University. This is the Medical Billers Network Live. We are here every Thursday at 2 p.m. We talk all things in the business of healthcare, specifically focused around with our mission around improving the delivery of patient care by alleviating the stress and confusion in the business of healthcare. In this channel, we talk medical billing tips, tricks, and resources that we share for you guys to be more effective at what you're doing. And if you're looking at getting into the field of medical billing, lots and lots of resources here on the channel to help you do just that. And if you're just kind of tipping your foot in the water, we also can help you decide if whether or not it's the right place for you. So if you like hanging out in all these other places and spaces in the digital world, you can click on that or whatever that is when you scan the little QR code and select whatever platform you want to follow us on. That's also going to get you to our links page, which has lots of information about our offerings. And so if you're new and you like this content and you think I'm kind of interesting, you can click the subscribe button, hit the notification bell. You will get notified when we put up new content, when we schedule premieres, which are videos that go up that you guys can interact with us directly in the chat. And then you can get notified when we go live. And so there's lots of content that's coming out in different forms on the channel. So it will let you know that it's there. So if you don't know who Inlera is, we have two parts to our company. One is a fully functioning operational medical billing company, a revenue cycle company. We do consulting with practices as well through that arm, and it really depends on the type of practice. We've kind of scaled back our offerings because we have a lot of focus in the other area, which is what you are enjoying right now is Inlera University. So education and training, coming soon, new podcast as well, and community content that is totally free. Then there's also some opportunities for you to engage with us on in a paid way as well. The reason for that is that it gives more structure, right? So actual course content. So here's some example of the courses that we offer and programs. So the CPB Readiness Coaching Program is an offering that is an instructor-led offering, which means that you pace along with me, the instructor, and we get you ready to sit down to take the test. It is not a medical billing training program by any means. That would be our Mastering Medical Billing. CPB is like, I know enough about billing and I just want to get my certification so that I can prove that with my credential on my resume or just on my business card, what have you, that's going to get you prepared for the exam, for sitting down to take the exam. We also have Language of Medical Office Reception, which is in a pre-order right now. That's a self-paced course, which means that you can watch it whenever, you can have access to it for however long you desire, continue rewatching it, maybe revisiting it as you're on the job. There's some courses on the site that are just that, including the one that Michelle mentioned earlier, which is the medical billing bundle. All right. So with that said, I'm done with my housekeeping. It's now denial management time. Yay, that's cute, Nicole. So grab your pen and paper, because if you haven't noticed already, I talk a little fast, and you can slow me down if you think I talk way too fast. Actually, here on YouTube, if you're watching on YouTube, you can actually slow my voice down, and you can rewatch it. You can rewind, you can pause. And if you have questions throughout, feel free to pop those into the comments throughout our discussion today. And if you find this video at a later date, feel free to pop the question into the comment section, of the video as well. And we will get to those. Both Nicole and I review those on a regular basis. So we will get to those, hopefully respond directly to you, or we'll respond with another video. So with that said, I'm going to take this boring presentation out of the way. So here's the deal, is I like to give you guys a lot of information. I know that sometimes that can be a little overwhelming. So if at any point you're like, I need you to expand on X piece of information, I will try to pause and do that in this video. But I will also suggest that these live streams we'll call them more like webinar-esque, in the sense that I don't like webinars. So I don't like saying that. I don't like webinars. I don't like that most people create boring webinars that are just presentations, no face, no changing positioning of the camera angles and things like that. That's my first anti-webinar statement. But I will say that that what I do enjoy is that it does give you a lot of information at one time. It can be quite a lot to take in or to absorb. So what we do a lot, and what we have mapped out for the rest of this year, is a lot of content that is given to you in a lot of different forms and expanded upon. So in this time, when we sit down and we talk about effective denial management, there are going to be a lot of follow-up videos, shorts, and other resources that we're going to release on some of the other social media channels that will reinforce the things that we're teaching you. All right. So what I go over right now, I want you to ask your questions, and I will absolutely zip through and answer those questions, whether live here or if you're, responding in a comment at a later date. But I absolutely want you to stay plugged in to any of the follow-up, because we will go a lot deeper. So in this live stream, we're lunch and learning together. So we're together for just about an hour. So give me 1 second. Let me open my notes back up on the screen. Okay. All right. So keep adding your questions. I just minimized everything. Sometimes give me 1 second. Okay. All right. I just saw a question come in. Let me see. Do I teach some coding in the, so in the Mastering Medical Billing class, you get an introduction to coding. It's called Medical Coding 101. That course covers the general concept of what medical coding is, the different code sets, understanding the resources available, whether you choose to get books or coding software, things like that. We do not go into how to code, right? So we talk about the function of coding, the options available to you if you choose to be a coder in addition to being a medical biller, or if you just need to entertain the idea of being familiar with your specialties codes. I also go over the specialty specific resources that are out there in the industry, because you may not need to go out and get your certification for the CPC, for example. That's the Certified Professional Coder certification. But what you may want to do instead is to go directly to the association or to other companies such as Optum to grab a specialty specific coding resource document book, depending on what they have. So they might have some quick reference documents for your specialty, or they might have an entire textbook for your specialty. All right. So hopefully that that helps answer your question. Like, could you expand? Oh yeah. So funny, we actually are working on this. I don't know if someone recently asked the question. We just had a meeting yesterday and it was discussed. So we are going to be doing more breakdowns of our courses, and we're establishing like a one-pager document too for you guys to kind of quick reference what our offerings are. But yeah, I would love to build out the website to help. We're limited in some ways, but not in others. So hopefully it gets what we need. TT, thanks for your question. All right, so here we go. So we're talking effective denial management and medical billing. So most important thing that I need you guys to wrap your heads around is that many of us have the desire to work denials when we are presented with a problem. So you get really excited and you just dive in, got to work on it. And you just take the first one on the list. And I want you to check that behavior and ease back from it and say, that's not what I'm going to do. I am first going to organize myself. You must pause, get a lot organized before you start to do the work. There's a lot of reasons for this. The main reason is you could be working on something that is not worth your time, your energy. You could be working on the first 20 things that are not worth your time and energy. And number 26 or 25 on your list is the big kahuna, the thing that's going to make a big difference that you can actually get reimbursed. So you'll have to be able to understand that restructuring, reorganizing yourself, creating a lot more of a clearer picture for yourself is going to help you move forward. So with that said, you need to really get the full picture. That is my first point, is get the full picture. Get the full picture of what you're looking at. So if you're coming to a practice for the first time, or this is your first time touching denials in an effective way, you are going to put on your revenue cycle manager hat. You're going to ease back, zoom out and say, even though I might know how to resolve denials because I've been working in medical billing for 10 years, I'm going to pretend as if I don't and take myself out of that technical world. In the weeds, you cannot see very clearly the path to go, what path to take. You can't figure out what path to take if you can't zoom out and really get a really good sense of that full picture. All right. So it's very, very important that you recognize that the full picture is the first thing that you need to clarify before you take action. So how do you do that? So first thing is, it's going to depend upon your software, what exactly is available to you. I would love for you to be able to run reports that give you top denials and be able to kind of give you a sense of what exactly has taken place over whatever period, whether you're just looking back on a year or a month or 90 days, right? You're going to run the report if it's available to you. Great. If it's not available to you, and what you have available are things like remittances, which are the payment details from our insurance companies, or paper EOBs, then you are going to need to build a manual resource that helps you record the denials that have arrived. I know that might seem like a lot of work. It is what the software could do for you. And if it's not doing that, it will behoove you to invest the time to create the document. All right. And it doesn't have to be all the information. You don't need to put the value of the claims and the procedure codes, and you don't have to build a software report. What you need to know is the reason for the denial, when the denial came in, and the insurance company at the very least. Now, if you are going to be working from this document, you'll also want your claim number, patient ID number, whatever that criteria helps you search for that patient so that you can reference your patient. What we're trying to glean is what is our top denials and how frequently are we receiving these denials, which payers are causing the most denials. So really those top three things that I just mentioned is the meat of going to provide you the meat of what you need to be able to discern, right? To be able to discern where the next best step, what the next best step is. Now, If you find out you're using this as like a work list, you might want to add more information, more criteria to help you work down this list. But that's not what I'm advising you. What I'm advising you is to make sure that you have the ability to find out what is your top denial, who is your top payer that is causing these denials as well, so that you can really start to create a plan of action. Okay. So once you have this record, whether it is one that you have created or a report that has come out, you are trying to identify at least the top 5 denials. Now, I say, there we go, the top 5 denials. If you find out that your top 5 denials still accounts for only 20-30% of the volume of denials, how do you do that? You see the total number over 90 days. Let's say, as my example, we're looking at a 90-day period. My total over 90 days is 1,000. And when I do these top 5 denials, I still only get to 300. Then you're going to want to expand to at least maybe your top 8. But I'm guaranteeing you that if you look at this objectively, you're grouping together the types of denials. So I'll give an example is every insurance company has their annoying use of the ANSI denial codes. Sometimes they'll use I don't want to give you guys too many codes, but they'll use one code that communicates that the patient is not eligible. And then they'll use another code that says that the plan is terminated. And then they'll use another code that said they can't find the subscriber. All of them mean the same thing. There's an eligibility issue. So you're grouping together those types of denials. So you clearly see, okay, this is an eligibility issue denial that I'm receiving. And how can you do this? You can go to the resource online that provides the ANSI codes, the top ones, or you can look at all of your codes that your system has ingested from ERAs, from your electronic remittance advice, and group together what you know to be accurate, to be associated, these rejection, the denial codes that are associated. You can also look at resources online. There are companies that have done this for you, that have said, okay, what the example that I just gave, if you see patients not eligible, if you see this, and this, they all mean there's eligibility issues, right? You can take those recommendations and use that as your guide, or you create your own, okay? So once you've established your top 5, I guarantee you're going to be close to somewhere like 75% of your denials are going to be accounted for in this top 5 denial types. And I'm going to give you some examples of the common denials that we're talking about here. So we've talked about this at great length over these last few months. Hopefully you've watched some of those videos, but data capture. We talk about data capture. We're talking about anything that we need to create our claim, likely demographic information. So our patient's name and date of birth, their ID number, perhaps the name, ID number, perhaps coding information could be wrapped into this if it is data capture that is being entered in by your EHR or your team member that's data processing. That also would be, because anything that goes onto your claim that creates that claim for it to go out, right? So we're thinking about all of the potential things that could cause our claim to be sent back because of the data, the information that is listed on the claim. Okay, so that data that was given to us by the patient or by the provider, right? So I'm kind of like holding that loosely, because sometimes there were coding specific, like I think it was Tyra's example of the code not being valid anymore, or not being specific enough. Excuse me. That is more kind of a coding issue, but it also means that somebody could mean that someone just put in the wrong code, right? You could have had the right procedure code, or the right diagnosis code, but the wrong thing was entered, right? So that data capture is one really, really top denial for pretty much every specialty. It just covers so much ground, okay? It also, data capture could also mean that the wrong ID was put in, or you're missing a prefix for a patient's ID that's required, like a W for Aetna, or 3 letters for alpha prefix for your Blue Crosses. The next denial type is our eligibility. I gave some examples of it earlier. So it means that your patient either gave you the wrong insurance information, or you did not update to have the correct information, and that information that was submitted to our insurance company is no longer valid. All right. It's not billable, or it's not active, or the patient just needs to reach out and provide information to keep it active. And that's in the example of like a Medicaid plan to be able to continue to receive those benefits. All right. Next type of denial that's often in our top 5 as an example is our coding denials. And that I'm staying separately from our example earlier of the capturing, meaning something that was provided to you being wrong. I'm thinking more coding exclusions, right? So correct coding initiative stuff, the CCI stuff, things that require, that are not allowed to go together or require a separate modifier when they're used together. Those types of denials are coding guideline specific denials. That is a very common issue, especially if a provider or practice has kind of started their practice without any advisement from a specialist in their God, I shouldn't use the word special so much. Specialist in their specialty. Someone who is an expert in their specialty is really a better way to phrase that. So when you have a new practice, a new billing department, and you have the opportunity to bring in an expert that knows your specialty, I 100% recommend that you do that. When we consult with providers and practices that come to us and say, oh, we would love your help, can you help us? I do not like playing the, sure, I'll help you, and I go do the research thing to try to help them. No, I'm going to find the person that has the information, that hopefully knows the answer for that specialty, right? We are not in the business of trying to fake it to help somebody, right? We're gonna be like, okay, great, like I'll help you, and then you're like there reading and trying to become an expert coder overnight to help someone. So our goal is not that. You want someone to come into the practice that can advise the practice properly, right? So if that's your situation, please, by all means, go to the experts, seek them out. It's not going to cost a ton. It's going to be a wise investment. You're going to save money in the long run. So do it. Other thing is other denial, common denials are out-of-network denials, not credentialed, right? Folks that are billing claims and think that the provider is in network, and they kind of do the hope and pray method when they send the claim out. Claim comes back, provider is not found in the network. You thought that the provider was in the network, but in fact the practice was, and 2 other providers are, but this provider is not. That is a very, very common issue in our practices that have lots of providers and or are taking on a lot of insurances without doing their due diligence, basically. All right, timely filing. There's Osama's top denial there. So timely filing is the next one. I have my issues with timely filing denials from a manager perspective, because I'm a big proponent of, you guys know this if you've hung out long enough, of really trying to hone in on your process. If you don't understand how to establish a sound revenue cycle process on the front end, then you will have these problems downstream with timely filing. If you have timely filing denials, if you're coming into a practice and you see that, right away, you know something is broken on the front end of the revenue cycle. So that first quarter of our revenue cycle, something is not working. Something is broken, okay? Last one that I want you to be on the lookout for, because I'm pretty sure that these denials are going to be ones that you'll probably see. These are the categories that I'm mentioning, kind of grouping together. These are the most common categories that we see. They've remained in the top for almost decades now, but it's the non-covered and not medically necessary services. So non-covered meaning the patient's plan has determined that a service is not covered by their plan. Okay, so it's not covered by their according to their benefits. Right, that's a little different than a patient not being eligible, meaning their whole insurance is not active. That's different. Okay, we're talking about somebody having a procedure that is not allowed by their benefit plan. That is a different type of denial, and oftentimes one that may not be reimbursable even after you work on it. Okay, so I've gone over just like the top denials in the industry. So you're looking for those. I'm hoping that you're finding your top 5, like we talked about in the first part of our discussion here. So once you've established what your top 5 are, right, you are going to put that off to the side for just one moment, And then you're going to be thinking about, all right, I got my denials. What about my correspondence? What about that stack of mail that has just been collecting dust over there in the back corner of the front office or wherever it gets stashed away? Unfortunately, that is just a forgotten piece in the revenue cycle for so many, not just practices, but even billing companies. Correspondence is just stacked to the bottom. And to be absolutely frank, most of our correspondence is actually the thing that should be close to the top. Because when you look at correspondence, you might see these types of things. You might see the claims went to the wrong place. They, instead of sending you a claim rejection, they didn't have you in their system, so they couldn't send you back a communication. They send you a letter, maybe claims are attached, and they say, we don't know who this person is. And so you have something that is a rejection, which we've talked about, this happens before our denial work. Our rejections should be worked first because that means the claim hasn't even been accepted for adjudication or processing, right? If we know that this information has been given to us in a letter, we have the best method of more quickly getting the claim back out the door, because we see, oh, oops, maybe we forgot to change the insurance, or maybe we are missing a digit, or maybe we sent it to the wrong payer ID, right? All of these things are possible, and it could be coming in the mail. Other types of things that come in the mail, if you're a surgeon, and a request for an operative report, something hopefully very simple for you to pull out of your software to send to the insurance company for a surgical claim that I'm sure is for thousands of dollars, right? So something like that could be a very quick and easy fix. If you're a surgery practice, prioritizing your correspondence is going to completely change how your flow of revenue comes in. We see it so often, these practices that come in and they're like, oh, we've got these big denial teams from our billing company. And we're like, cool, who manages correspondence? We're like, oh, that's just like our office manager. Like, oh, well, who sends that to the billing company? Well, she'll send it like once a month. Like, okay. And so how many letters do you find in there that have operative reports? Well, like 20, 30 of them. So for a month, you have been holding on to an entire batch of potential money and just letting it collect dust. When the correspondence came in, you could have had someone, whether it's in the billing department or billing company outside, or someone in your office, someone responding to those types of urgent requests faster. Okay. So correspondence is very, very important. Putting that to the top of the list alongside trying to organize yourself with your top 5 denials is vital. Now you're going to determine what your approach will be with correspondence based off of what you find in your stack of mail. Okay. I can't give you all of the things to do. I gave you a couple of examples. It's going to depend upon what you see, right? You might see things that are going to be quick, easy fixes, or you might see things that change your approach completely, and you take my top 5 and you make that second on your list, and correspondence becomes the very first thing. Right. So just wrap your head around correspondence, figure out what you find in the Department of Correspondence for your practice or business. Okay. So you've created your top 5 list. Back to our top 5 denials. You have a clear indication of the types, the 5 denial types that you see, those categories that you see most frequently in your practice. What do? You now are creating steps to resolve the denials. Now, that might be, if I'm manager, that might be me going to my staff and saying, hey, when you see these types of denials, what do you do? And you are scribing a process. I just hit the mic with my chin. Sorry. You're scribing a process, or you are establishing one if one doesn't exist, right? You're trying to get feedback from your team to find out what their current process is. You're documenting it at the very least. And maybe you have a bigger team and you talk to 2 or 3 of your best billers. You get feedback from them on what their process is for those top 5 denials, right? And this is a little bit of a team effort here, right? You're going to need to engage your people. When you do that, then you take those perspectives and either blend them together, or you take them, pick the best out and make it better, or just document if it was great. If it's resulting in payment, we are happy So we're going to document that, and we're going to disseminate that information to our other team members, because so frequently we have billing departments where everybody is in their own little cocoon, and Sally over there does her own process, and Jane over there does her own process, and Tiffany over there does her. You've got 3 different people doing different things, and guess what? Producing likely very, very different results. So you're going to want to find the person who is creating the cleanest, most successful process for your business. And how do you do that? If you're split up by insurance company, you're going to be able to get a kind of a clearer picture on what looks better, right? Who has the cleaner AR, basically? Who has claims that have faster reimbursement coming in, okay? So when you have these steps and you're documenting them, this becomes your holy grail. This becomes the thing that you use for these denials, and that everybody who is in the practice now or who comes in gets trained on these steps on how to resolve these top 5 denials, okay? Again, we're really focusing on the top 5 because we're covering the most ground with these top 5 denials. So if you this month say, I'm going to focus all of my attention and energy on my very top denial for my practice, you're going to make a massive impact. Don't try to do all 5 at once. Just focus on the one, right? Then next month, you're focusing on the second one. You're establishing the process. You're disseminating it, right? So you are creating a sound workflow around denials and denial management, something that can outlive the team member. God forbid you've got superstar, the rock star biller, and that's the only one that you trust with all things. So you got problems, they come in, it goes to that person. That person has a big life change and is moving to Korea, and there goes the success of your business. Instead, you can choose to focus all of your attention on really creating sound practices and processes while you have those team members available to support the creation of those things, okay? We've done a lot of different videos on process establishment. If you haven't seen any of those, you'll want to refer to those videos for my recommendations for how to document those types of things, and we can revisit those again soon. So after you've got this processes, let's kind of pretend as if you don't have any support. You don't have anyone right now that is there to help you. What do? You've created a little bit of a process for yourself. If you've already gotten resources from the specialty guides that exist out there for your specialty, they likely have some of the information that I'm talking about, things that might have top denials for your specialty. They might even have appeal letters for your specialty. They might have, here's some recommended ways to resolve these types of claims. So you have some starting information to kind of move you in the right direction, to get you motivated, to help to kind of start getting this engine running. And then what I would implore you to do, depending on volume, if you've got a lot going on there in that billing department, is start enlisting help. And now that you have processes, you can add people to it to support, to actually get you further faster, okay? If you are at this stage in the business or in you don't have the resources available to bring on trained team members, best thing is at this point, you now have processes that will somewhat be newbie proof, we'll call it. So you can bring someone in to say, hey, here's this appeal letter. When you get this letter or let's use an operative report as an example. Hey, here's this or correspondence file. When you get these letters that come in requesting operative reports, here's the process to get those reports from the software. And here's a letter that you can attach, or a form that you can attach for when you upload this to the portal or mail it or fax it into the insurance company. Okay. Now you have a very clean way to enlist the support, clean process for them to follow. You have the opportunity to maybe be grooming someone new, maybe to start to develop a team member to be a biller, to be a billing office support team member, right? Someone that might have a cross function in your practice. Okay. All right. So we are leveraging support, and you have gotten to the place of where you are establishing some of those, what we'll call resolution steps. The thing that you'll need to weave in to these resolution steps and helping yourself kind of organize is knowledge about your payer mix. Okay. You need to know important things. Those things are timely filing, not just for claims, but your timely filing for your appeals and reconsiderations if they have different times for those things. Oftentimes, appeals and reconsiderations or reprocessing for claims are the same, but you'll want to be on the lookout for those timely filing limitations that would mean that you would have to work on those insurance companies faster. So let me explain. So if I have 3 insurance companies, I've got a Cigna, I've got a United, and I've got Aetna, and I do not remember their timely filing limits for appeals off the top of my head, so we're going to pretend. So I've got my Cigna. My Cigna has a 90-day timely filing. My Aetna has 120 days, right? My United Healthcare has a 30-day. Who's going to be the most important for me to be working on? United Healthcare. Even if I have more Cigna, I'm going to work on my United Healthcare faster because we know we have less time. And if we're in a surgery practice, we know that the value of that claim that might not be reprocessed in time is going to go down, right? Or to zero, right? It's going to be non-existent. So it's very important that you recognize that your knowledge of the payers and their timely filing goes beyond timely filing for claims, because the insurance companies also dictate how long you have to respond to a denial, so that let me establish that. If you don't know what I'm talking about with these timely filing for denials or for appeals and reconsideration, it means that they have sent you an EOB. That EOB has a date on it. From that date, a clock starts. Every company has a timely filing for denials and appeals that has a clock on it, and every insurance company has their own policy that says this is the length of time that you have to ask us to consider or reconsider, meaning determine a claim for payment, or to have us reopen this with new information. So even if you do all the stuff, you're like, okay, I've got all the ammunition, all the perfect documentation, and I know this is supposed to be paid, they may say, oops, sorry, we're now past timely filing for appeals. Okay. So very, very important to know what those rules are. I should also throw in the mix that sometimes they also have a separate timely filing for corrected claims, meaning like if you had a procedure code or a diagnosis that goes out incorrectly, you might be under a different time frame for those types of claim corrections as well. So very important to know your payers and know your payer mix. And you can break it down too to those top payers, the ones that you have the majority of your denials for, so that it can help you direct your efforts to those payers. Okay. So we're adding this payer mix knowledge. We're adding this payer mix knowledge to the knowledge that we have and the processes that we've established for how to work our denials. And this is going to be the plan of action that's going to help us really get fast results from our efforts. Okay. We are trying to maximize our efforts. This whole conversation is about maximizing the effort. Okay. I don't want you getting to the denial list and being like, yeah, I'm going to power through this. And you just like set this target for like 50 denials a day. And you've got 5,000 denials, right? I don't care how quickly you work, you're still going to lose money if you don't organize first. Okay. I hope I'm making my case on the organizing. Just let me know if I'm making my case there. All right. I've got a couple more points and then I'm going to visit our questions. So we have established our prioritizing. Let me just quickly say this. So if you didn't get this part about the organizing according to the payer mix, you're organizing according to the ones who have the shorter timely filing, meaning less time, right? And that is going to be taken into consideration along with the volume. So your first point of criteria is the ones that have the least amount of time, and then you're going to look at how many, and that's going to be the next thing that's going to bump them closer to the top of the list, because there's that many for X payer that has the shortest time. Okay. All right. Next, templates. When you do something, I guarantee you that exact something that you have done, you will need that something again in the future. Because in healthcare, especially in our practices that are hyper specialized, it is rinse and repeat. You will be seeing the same thing over and over and over and over and over again. All right. If you do not create templates for yourself, even if those templates are 2 sentences that you are copy pasting into your payer portal, it will still save you time if you create it in the most useful way for you. You should have a document that you are copy pasting from and saying in changing out the different criteria or adding in the criteria that you need for your one unique scenario, right? The uniqueness of your scenario, which is going to be date of service and potentially diagnosis code if it's something related to it that you're having the sentences related to a diagnosis. Okay, so I'm talking about the communication that you're sending electronically online to your payers to ask them to reconsider a claim. That information that you are asking them to do, I guarantee you, is something that you are going to be doing over and over again. I'll tell you guys a story. When I first started my company, I was like, I don't know enough. I had already had 2 clients. And so I was running a practice, and those of you who hung around here long enough know this. I was already running a practice. I was very young. We had 2 locations, 3 doctors, and I felt like really good about it. I convinced them to let me take over their billing outside and trained a new office manager, all that. Well, in short, I felt very uneasy. Keep in mind, I'm really young. I'm 20 years old, right? I'm like, I feel like I don't know enough about how a billing company should operate. So I went and got a job at a really large ENT practice who had billing as a massive second department that took up an entire floor of the office building. So it was a big department. And I'm thinking, I'm going to learn all this stuff. It's going to be amazing. It's going to be so great. I'm going to take them like a sponge. And so while I have my billing company that I'm starting, I start working for this practice and realize very quickly that they have a crap ton of work. Absolute mess. And at this time they're using Centricity. Those of you who know Centricity, and they big lists. We were split up by payers and providers. So some providers had multiple team members involved depending on their payer mix and the type of specialty and things like that, and some of us had just one. My list was, when I first started, was like 8,000. They had 0 templates, they had 0 resources for me as a biller, and keep in mind, I had this time worked in only one specialty. So I was like, oh my gosh, this is scary. So I powered through creating template. For the first 40 things, I was like, all right, I'm just going to do a template for all of them because there's no way that I'm going to be making letters for that. And at this time, you guys rewind, there were no payer portals, none of that fancy stuff. It was a long time ago. And so I am feeling like I'm never going to get over this mountain, right? I'm just never going to get there. So I start creating all these resources for myself to hoping that I can use them again. Well, can I tell you guys this? I realized very quickly, this was within the first 6 months of me working there, massive results. So much so that I got offered an assistant position to the billing. It was a CFO that ran the billing company basically for the practice. And she had a billing manager that was like her assistant. I was offered the assistant role to the billing manager role within that first period. And they adopted all of my templates that I had created for the practice, literally overnight. And at that point, instead of me taking an assistant role, I quit and just continued growing my company because I was like, I don't really need this. So clearly I know more about what I'm doing in my approach than, these guys that I'm thinking I'm going to learn a ton from. And now I loved the practice. I loved the people. What I didn't love is the fact that, I was going to be sharing all of that great knowledge with a place that I probably could have had more success with my own business. So that's what I did. So hopefully you guys understand that you can stand out. You can stand out in your billing department, in your practice, if you are the person who is willing to put in the extra effort and organize and strategize before you do all the busy work. And you just have to explain it to your higher ups. If you're someone who is, who has multiple levels above you, you just got to let them know, hey, I'm new here. I want to take in what you guys have. If I could just have a couple of days, I may not be able to reach my targets during that period. I just want to organize myself, but I guarantee you that it's for the best outcome, with the best intentions for my plan. And you're just asking them for, maybe a handful of days to just spend some time to get organized, to create a strategy, to create a structure for yourself, that a method that you can follow. Okay. So I hope that helps. All right. Lastly, my last little point here, and I'm trying to read it because I'm like, what am I saying here? Okay. I am a little biased because I believe that all claims matter. I really do believe that it's important that you get to the end of your AR, the end of your denial workflow list, the end of your rejections list. I believe that wholeheartedly, but I know that realistically, we're in healthcare. It's hard. The volume is high. I know that it can feel near impossible for you to ever get to the end of that list. I know it. All right. What I will say as like a point of encouragement for my folks who feel like you just don't have enough resources available, enough support, enough software, maybe not even a good enough software to help you, right? You don't get disheartened. Don't feel like you're stuck, because there's still opportunities for you to make an impact. What you're going to want to do, especially if you're someone who's in charge and able to make these decisions, you're going to establish some rules of engagement. So you're going to say, okay, claims that are of this value, meaning X dollars, right? This particular scenario of minimum amount, these are the claims that we will touch no matter what by the end. Let's say claim denials, we will touch no matter what by the end of every month. Okay. Our goal, and now say by the end of the month, by the end, let's say the 10th of the following month, we will have worked all of our denials that are X dollars and greater. So you're setting some rules of engagement, some expectation for you or your staff to follow that feels more approachable. Okay. Something that is easier for us all to wrap our heads around. We're like, oh, okay, so $500 and more. I'm focused on those numbers. I know I got to get through all my claims that are $500 and higher, right? Whatever that number is, it really is going to depend on your specialty. But you want to establish those rules of engagement. And then my leaders, especially, you guys must decide how many times you allow your staff to touch a claim because, and I say this having worked in specialties that do not have great reimbursement per claim. And when you do that, when you have a practice that the reimbursement average per claim is like $50, $60, and someone has touched that claim 7 times, it makes you want to pull your hair out, because you know that you have not just lost money, but you have now paid to have someone work on those claims. So you must establish rules that say you are only allowed to apply X strategy 2 times, all right? Or whatever it is, according to the claim, again, according to your practice's rules. You have to also maybe determine that based on the value, right? So that's my list. I have not looked at comments this whole time because I wanted to get through my list. So I'm going to open up comments, and I love it. There's some good comments out here. So Tanya's in the house. Hello, Tanya. Thank you so much for hanging out with me. Tanya's a member. If you don't know what I'm talking about, we have channel memberships. We have 2 levels of channel memberships. Our first level is you get these cool little badges. You get an opportunity to support the channel, and you get access to a couple of other things that I can't remember that are on the channel membership list. And the second membership level is includes our Q&As and some other resources and discounts to courses and all kinds of stuff. So if you don't know what I'm talking about, Nicole will probably put the link, if she hasn't already, out there. You can check out the channel memberships. We have our first live Q&A on the books already on February something. So I don't have my calendar open, but I think it's like the 2nd or 3rd week in February. So if you're a channel member, yay. And I look forward to fielding questions, and it's essentially a little like this forum, except we're having a dialogue and we're going a lot deeper, and you guys will be able to bring your specific questions to into the space. So Let's see. Yay, I found the YouTube. I mean, the Facebook. Yay, awesome. I like YouTube better. That's funny, Crafty Coder. I love it. And I like your name, Crafty Coder. I'm a little biased too. Nicole and I were joking. We're like, what is our favorite social media? We're like, yeah, it's definitely YouTube. Even before I did YouTube videos, I live on YouTube. So I love it. Yeah, a ton of coders out there that don't understand anything about reimbursement guidelines, started as a biller and became a coder. Oh, okay. I love it. You love AR. Oh, I love that. That's amazing that you've seen both sides. And yes, unfortunately, we're all guilty sometimes of like kind of isolating ourselves and saying, I'm a biller. I don't know anything about coding. I'm a coder. I don't know anything about billing, and not doing enough of that cross education. Those of you who've hung out with us know that I say this a lot. I'm always preaching this, that you guys would glean from just talking to each other. Actually, I think in my conversation, I believe either with Victoria or with Codemaster Coach that's coming up recently, we had a conversation with both of them, and they the conversation was like, we just need to know each other. Like, even if it's just like, hey, come hang out in my world for a little while, like in our practice, in our billing department or whatever, like just get to know each other and understand each other's struggles. It means a lot to us because we get a chance to show like, hey, here are the things that problems that you're causing downstream. And then the coders are like, hey, these are the things that I hate when I get the feedback from my billers out there, like help me understand so I can get better. Right. And it really just helps us to hopefully have better working relationships. Hopefully it makes us feel more supported. All right. Yeah, we all need to work together. And yes, right. That's exactly what I was saying. Crafty Coder got it. So yeah, 30 days, that 30-day nightmare. We had a practice that we were serving in Florida that not only Florida has had, and I don't know if it's still in place because we're not working with them, but they had a lot of personal injury cases, and the statute or like the rule in Florida was you had to have the claim filed within 30 days. So it was a very common practice that people sent their claims certified mail, y'all. Like certified mail, every single claim with all the documentations attached and all of that, every single claim certified mail. And you had to have the claim filed within 30 days. So if you're an outside billing company and your client is slow with getting you documentation or whatever, like it was all the words that are coming up for you right now, fill in the blank, not fun. It was a big pile of poo. But so we don't work with those types of practices in Florida anymore because it just costs too much money as a billing company. So fantastic. Okay, yeah, Nicole put support the channel. So if you didn't find that link on one of those QR codes, you can check it out. Thank you so much, Angelica. I'm so happy that you were able to get the audio and hang out with us for a while. Yay. So I'm nosy. I'm all over. I love that, Crafty Coder. Listen, we have to be nosy. That is how we are successful. We ask more questions. We are curious. And it also keeps life fun. Like if you just like, I'm just going to go to work and just do my thing. And, and then you go home, you're just like, you lose what you're doing. You're no longer excited and no longer interested in what you're doing. And that's just bound to happen fairly quickly if you aren't maintaining that level of curiosity. It is a natural human trait to want to be curious. And if you don't tap into it, that muscle gets weakened, and then you no longer have the ability to easily learn, and you get frustrated. All of those other negative emotions start to rise up. You're just annoyed, you're frustrated, you're blah, 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 because you aren't choosing to continue to learn and tap into all those things. So yay. Awesome. Oh, Crafty Coder, you're in Florida. All right. So maybe you know what I'm talking about there. So book stamp to make sure. Yes, that is so funny. It's one of those things that just is mind-boggling to me, that it's in a state where there's so much activity, personal injury activity, that they would have such antiquated processes for getting the claims out there. Very, very exhausting. So yeah, you will get frustrated, Tyra said. Yes, you will. And tap out is true. It's true. This medical billing is an industry that can love you back if you recognize the importance of community, recognize the importance of really understanding more deeply the other parts of the revenue cycle and the mutually beneficial relationship you could have with those parts of the revenue cycle. Most of the people who end up hating their jobs and hating the, other departments and whatever, it's because they haven't recognized that, like, hey, I have this job, I have this opportunity, I have this paycheck because those other people do their jobs. High five. I'm happy you're doing your job. Like, recognize that, like, we all need it, because one spoke missing, one thing, you remove one thing from that revenue cycle, everything else falls apart. All right. That's what all matters. All right, cool. I love it. I was freezing a little. Really? Darn. Sorry, guys. All right. So I think that covers all of my things. And I'm looking, did I miss any questions? I feel like you guys have to have questions. Where's our questions? Do we have any questions? Was it too much information? You're just letting it like soak in? Is that what's happening? So, thank you. Thanks for hanging out, Crafty Coder. I love it. That's so sweet. All right. Well, so here's what I will let you guys. Oh, sorry. Thanks, Nicole. I will let you guys absorb all of the things that we talked about today, and put comments in after the replay. Watch it maybe another time or something, and let me know what questions are coming up. If you're in the Facebook group, Medical Billers Network has a Facebook group. If you didn't see that on the other slides earlier, if you're in the Facebook group, put the questions up there and ask those questions, and myself or other people hopefully will chime in and answer those questions for you. I love interacting in there. I was under the weather the first couple of weeks into the year. It was very fun, and so I'm like off of my normal rhythm of things. But I will be back in both groups. We've got Medical Billers Network, and then we have Billing Company not billing company owners. I don't remember. Gosh. Yeah. Medical billing company leaders. Thank you. Nicole put it down there. Thank you. Yes, we've got those two Facebook groups, and I'll be hanging out there a lot more. So if you like to hang out on Facebook, join there. And then again, channel memberships. We are back. Channel memberships. Those are our channel memberships down there at the bottom. Thank you. We are back next Thursday, and we'll have more discussions here, but over these next few days, make sure you're subscribed and stay tuned to the content, because we have now turned on our engines, and we will be having coming out all throughout the week. So stay tuned to that, and then hang out with me on the Facebook group and other spaces and places on the internet that you like to be. But until then, I will see you in the next video. Take care, friends.